COVID-19 pandemic?
I think your question has to do with the underage or something, or early marriage, sorry, not underage. And I cannot agree less with you that if we are talking of safe motherhood, we must address the issue of early marriage. And essentially, what can we do beyond advocacy and education? Because one of the things that education does is to widen your horizon, to make you have an understanding of what is happening to you and around you. And I recall that the recently launched State of World Population Report, if I remember precisely, the theme is my body, my right. And that is instructive. My body, my right. So if someone, if a girl has the understanding and knowledge and education that, look, this is not good for me, then she will have a better approach to this kind of issue. So, but for now, and because don't forget, some of these things, they are culturally or religiously based issues. So we must continue in that advocacy and education. And I believe, irrespective of what other things we want to do, these are the major things that we need to address to really stem that tide. And of course, if we were able to overcome that, we would have gone a long way in mitigating the issue of unsafe. Because if you talk of safe motherhood, you also talk of unsafe motherhood. This year's Safe Motherhood Day is focused on sensitizing mothers and the general public on the need to patronize and utilize available maternal services amid the scourge of COVID-19 pandemic. Hence the theme for this year's Safe Motherhood Day, improving demand access and utilization of maternal services in the context of COVID-19 pandemic, with the slogan, quality, equity, and dignity for women. The successful implementation of the pillars of safe motherhood is crucial to the attainment of SDG 3. There is, therefore, the need for continuous community mobilization and awareness creation among policy makers as well as program managers by all stakeholders. As you may be aware, recent evidence from National Demographic and Health Survey 2018 shows that Nigeria has made some progress towards improving the health of women and children. I say no weapon fashioned against us shall prosper. Amen. Thank God for answered prayer. The federal government, through the Federal Ministry of Health, has been working closely with partners to ensure the increased use of high-quality emergency obstetric and newborn care aimed at swift reduction of maternal and neonatal mortality in Nigeria. In addressing human resources crisis, especially skilled birth attendants, the federal government made provision for the establishment of modified midwives service scheme, task shifting, and task sharing policy. Also, the Federal Ministry of Health, in collaboration with the National Primary Healthcare Development Agency, has also commenced primary health care and community maternal, perinatal, and surveillance response, a veritable process of identifying both direct and indirect causal factors of death, using information on each maternal and perinatal death to guide public health.
It is my pleasure to welcome you all to this year's Safe Motherhood Day commemoration. Safe motherhood is based on the philosophy that no woman should die while giving birth. The Safe Motherhood Initiative is a global movement launched with the aim of reducing maternal and newborn mortality globally. A review of the initiative showed a slow progress made in the implementation of Safe Motherhood Initiative and led to consensus globally to set aside a day for awareness creation and bringing to national discuss the responsibilities of different stakeholders in promoting the health of mothers and children. In marking her Safe Motherhood Day celebration, Nigeria today joins other countries of the world to commemorate this important event. The theme of this year's commemoration is improving demand, access, and utilization of maternal services in the context of COVID-19 pandemic. And the slogan is quality, equity, and dignity for women. Mothers are nation builders and should not be allowed to die from preventable causes during pregnancy and childbirth. The health and well-being of the mother and the newborn are strongly linked and constitute the focus of safe motherhood programs. According to 2018 NDHS, the national maternal mortality ratio is estimated at 512 for 100,000 live births. Maternal death accounts for 31% of all deaths among women aged 15 to 49 years, and the lifetime risk of maternal death indicates 1 in 34 women in Nigeria will have a pregnancy-related death.
Of the health system with maternal mortality ratio of 512 per 100,000 live births, most of these deaths are preventable. For every woman who dies of pregnancy-related causes, 20 to 30 others experience acute or chronic maternal morbidity, often with permanent complications, most commonly obstetric distress, that can affect women's physical, mental, and/or sexual and reproductive health. Current evidence suggests that the high rate of maternal and neonatal mortality in Nigeria is linked to delay in making decisions to seek maternal health care, delay in locating and arriving at a medical facility, and delay in receiving skilled pregnancy care when the woman gets to the health facility. The COVID-19 pandemic further strained the health system and disrupted the provision of essential maternal health services.